So yeah, hello friends. Today we'll be studying about the topic Cavernous Sinus Thrombosis. So in this topic, we'll be studying under the heading of the definition, proper anatomy, etiology, pathophysiology, clinical features, the diagnosis and the management of it. Okay. So yeah, coming to the definition, what we have is the formation of a thrombus in the cavernous sinus. Okay, so thrombus is nothing but a blood clot. Okay, blood clot का जो broken part, so that is called as the thrombus. So that thrombus is been kind of depositing over the sinus. So this is called as a definition of this CST, that is the cavernous sinus thrombosis. So you are coming to the anatomy. This cavernous sinus in the middle part is surrounded by the pituitary gland. Okay, it has a medial wall and it has a lateral wall. Okay, in this lateral wall it is kind of like concave shaped. Okay, now so inferiorly we have the paired sphenoidal sinus, and this lateral wall it contains third cranial nerve, fourth cranial nerve and the trigeminal nerve का जो ophthalmic and maxillary branch. Okay, so this contains three things: third cranial nerve, fourth cranial nerve, fifth cranial nerve, ophthalmic and maxillary division of the fifth cranial nerve, that is the trigeminal nerve. Now the fourth cranial nerve is the oculomotor nerve, and the third cranial nerve is the oculomotor nerve, and the fourth cranial nerve we have is the trochlear nerve. Okay, so in the medial wall we have is the internal carotid artery and the abducens nerve. So this is the proper anatomy of the cavernous sinus. Okay, so what is going to happen in the etiology or the cause of this is the two things. So first thing is the septic cyst, and second thing is the aseptic cyst. Aseptic cyst is nothing but this happens due to any kind of like trauma or the surgeries, but in case of septic cyst it may be resulting due to any sort of infection such as the sinusitis, otitis media infection, which is related to the ears, otogenic infections, properly canine space infections, facial furuncles and erysipelas. Okay, so this is about the pathology or the septic cyst cause. Okay, so we are coming to the pathophysiology. It may be due to bacterial infection. This bacteria is going to promote the thrombosis. So why this is going to promote thrombosis? This bacteria is kind of going to release some procoagulating substance or some toxins which is going to cause a tissue damage. Okay, so this bacteria is going to release some procoagulation substance which is going to cause a tissue damage by releasing such toxins. Okay, this is the formation of this is how the thrombosis is going to form, right? How is this thrombosis is going to spread? Okay, first thing is due to anterior route and second thing is due to posterior route. Okay, we have a proper diagram of the facial vein right over here. This is what we have is a facial vein, and when this facial vein it runs superiorly covering the nose and the orbit of the eye and the forehead. Okay, when it runs superiorly over the nose it continues itself as the angular vein. Okay, and when it runs above the eyes it divides further into supratrochlear and the infratrochlear nerve vein. Okay, now again this join itself behind the orbit, these two veins they join itself into the cavernous sinus, which is present right over here, right? Now in the anterior root what happens is that this facial vein it itself continues as the facial angular vein. This is how it is the angular vein, and then it itself again then continue itself as the superior ophthalmic and the inferior ophthalmic vein. Okay, and now this join and they are going to converge into the cavernous sinus. Now in the posterior route how the thrombus is going to travel, this is where is going to be called as a pterygoid venous plexus. Okay, we have the pterygoid venous plexus. There are two connections of this. Now the first connection is going to be directly through the emissary vein to the cavernous sinus, and second thing we have is the direction in the connection to the infratrochlear nerve. Okay, infratrochlear vein. Okay, now this emissary vein are nothing but they are a valvulus vein, and there is a blood circulation flowing into both sides. Okay, so this is how the posterior route. Now coming to the clinical features, diagnosis and the management. Now coming to the clinical features, there are mainly three signs. First thing we have is the eye signs, sepsis signs and the CNS signs. Okay, in the eye sign it mainly due to venous congestion which is going to occur. We have the proptosis, we have the chemosis, we have the three P's. Okay, proptosis, periorbital edema and the painful globe movements. We have the eye movements will be there. So headache will be the most important thing. So this is mainly due to venous congestion. So yeah, this is all about the eye signs. And coming to the sepsis signs, sepsis is nothing but a kind of an infection. Okay, so there is a kind of pattern fever which is called as a picket fence pattern fever, which is characterized. First thing is going to occur is the chill, followed by fever, and the next thing we have the tachycardia and hypotension, increase in BP and increase in the heart rate. Okay, sorry, increase in BP and decrease in the heart rate. So now yeah, this is all about the sepsis sign. And third thing we have is the CNS signs. In this CNS sign, this is a kind of like advanced case. Okay, what kind of features do we see here is a meningitis, Kerning sign. Kerning sign is nothing but when the patient is going to bend, keeping the legs forward, keeping the legs forward in the supine position, there is a pain in the pivot joint or the joint. Okay, so this is all about the Kerning sign. And Brudzinski sign is nothing but there is a pain or a knuckle rigidity where the superior knuckle lines and the inferior knuckle lines in the occipital triangle. Okay, so in their occipital area or the suboccipital area, so there we are going to see is the knuckle rigidity. Okay, again further if advanced case there is going to be coma and then resulting into the death case. Okay, so all these three signs are the important clinical features. Yeah, coming to the diagnosis is mainly due to six fixed diagnostic features that are called as the Eagleston criteria, which is based upon the venous congestion or the eye signs. First thing is based upon what? Known site of the infection, septicemia or the bacteremia, sign of venous congestion, paralysis of the third, fourth or sixth cranial nerve, neighboring soft tissue abscess or evidence of meningeal irritation. Okay, this is all. These six features are the Eagleston criteria for diagnostic features. Now coming to the management, if we are going to suspect any case of the CST or the Cavernous Sinus Thrombosis, what we are going to do is that we are going to start with the high dose empirical antibiotics. We use something called as cephalosporin or third generation cephalosporins or metronidazole, and in second term we are going to confirm through the diagnosis through any sort of CT or MRI, or we are going to perform some culture sensitivity test. Okay, in the CT or MRI, how do you diagnose this? Okay, I said just already that the lateral wall of the cavernous sinus, it has a concavity, but in the CT or MRI, if you see there is a convexity is going to be taking place, so that is going to confirm that CS is present. Okay, in the culture sensitivity test there is presence of Staph aureus bacteria and all. And again one more thing is that there is presence of what bubbles over the area of the CT. And now when we perform culture sensitivity test, there are two types of tests that we perform, specific and the aspecific test. In this specific test, what we do is we are going to give the antibiotics. Okay, first we start with the antibiotics, we drain the abscess or we want to put some incision and drainage, and we are going to do the heparin tablets. What is that? IV unfractured heparin. And we start with the corticosteroids and mannitol. What is the function of the corticosteroid is that it decreases the edema of the eye. Okay, and in the asepsis test we give all these things but except the antibiotics. Okay, so except the incision and drainage. So we start with the corticosteroids, we give the IV unfractured heparin, mannitol and the thrombolytics. Okay, and then last time if the pain doesn't subside or the thrombosis it doesn't subside, we give is the chloramphenicol IV or 1 gram per 6 hours. Okay, so this is all about the management, clinical features, diagnosis, etiology and definition and proper anatomy of the CST or cavernous sinus thrombosis. Okay, thank you.